In a book I published in September, the very first line of the health gap says, why treat people and send them back to the conditions that made them sick? And in fact, what I do in this book, and I've done in my reports, is to lay out the evidence for the social determinants of health. And yet we're faced with a paradox. People who are most concerned about health are healthcare professionals. And yet key determinants of health lie outside the healthcare system. How do we deal with this? Well, when the Lowe Commission came along, I was absolutely delighted, because what the Lowe Commission is trying to do is deal with the fact that people go to see doctors, healthcare practitioners, particularly in primary care, when they get sick. But there's a recognition that key factors outside the healthcare system are key determinants of ill health in the first place, and also determinants of recovery from illness. And what the Commission is trying to do is to resolve this paradox by asking the question of whether advice in the primary care setting can actually lead to action for individual patients on the social determinants of health. A key feature, for me, a very important feature of the Lowe Commission report, is that it relies on evidence, not simply assertion. And not only does it rely on evidence of what works, but it makes a strong plea for continued monitoring so that we know if things continue to work and improve or need adjustment. So it's both addressing the content of social determinants of health and how this can be improved, starting with the primary care encounter, but also the methodological principle of basing advice on best evidence. It recognizes that cuts in funding to local government have made this much more challenging, but it takes a realistic approach to saying what we can do. I've been trying to engage the doctors one way or another. Indeed, the reason I can't be with you, I was about to say it's an absolute pleasure to address you. It's not, it's a relative pleasure. It would have been an absolute pleasure if I could have been with you in person. The reason I can't is when this conference takes place, I'll be in Moscow being installed as president of the World Medical Association. And I made clear that my mission for national medical associations around the world and for the World Medical Association is to get the medical profession engaged on social determinants of health and health equity, the fair distribution of health. And I argue that the reason for such action is one of social justice. So I see the Lowe Commission as proceeding from the highest ethical principles of advancing the cause of social justice by asking, how can patients get the best advice to deal with the impact on them of the circumstances in which they are born, grow, live, work, and age, the social determinants of health. I'm absolutely delighted that this initiative is being taken, and I hope will change the way practice is done.